washing my hands. Hi, my name is Aisha. I'm a student nurse from Harper College. I'm here to do a head-to-toe assessment on you, okay?
Okay.
Can you tell me your name and your date of birth?
Jose Cardenas, May 17, 93.
Do you know what year it is?
2020.
Do you know who the president is?
Trump.
Do you know where you're at?
Yes, my house.
And do you know what you're here for?
Head and toe assessment.
Okay, so I could tell his speech is clear, his ABCs are all intact, his cognitive function is his orientation times 4, person, place, time, and situation. Also, he is alert and awake. Next, I am going to inspect. Oh, I also calculated his BMI. So his height is 6 feet, and his weight is 190 pounds. So his BMI was 25, which is overweight for his body. I also did the Snellen test on him to check his creatinine number 2, and his vision was 20/20 with contacts. So he could see at 20 feet with his eye contacts what a normal person could see with normal vision at 20 feet. I also checked his vital signs. I checked his temperature, blood pressure, respiratory rate, and heart rate. Next, I'm going to inspect his head and face. So I do see his head is normal size, appropriate size for his body, and his shape is a oval. So that's normal cephalic. I'm going to inspect his head next. So his scalp. So I'm just palpating all over, and I'm feeling for any masses, lumps, protrusions, or indentations. Then I'm going to look through his scalp for any lesions. Okay, so that's all good. Next, I'm going to check symmetry of his face. So I see his eyebrows, his eyes, nasolabial folds, and corners of the mouth are all symmetrical. So that's creatinine number 7 is intact. Next, I'm going to check his transmandibular joint. So I'm just going to palpate. Let me know if you feel any pain with that.
No.
And can you open your jaw and go side to side? Okay, I don't feel any crepitations. I'm going to check your maxillary and frontal sinuses. Let me know if you feel any pain, but you should really feel only pressure. So
No.
that's maxillary sinuses and then frontal sinuses.
No.
Okay, so that's all normal. Next, I'm going to move on to your eyes. So first, I'm going to perform the 6 cardinal position of gaze test. So just follow my pencil. Okay, so an accommodation. So that tells me his eyes move in a conjugate manner. Next, I'm going to test light reflex test. I'm going to do the light reflex test. I don't have a light, so I'm just going to use from the phone. Okay, so just look at my nose. His pupils constricted, and then his pupil constricted on the other side as well. So I would document that as PERLA. So that's pupils are equal, round, reactive to light, and accommodation. Next, I'm going to move on to your nose. So I'm looking at the nose. I don't see any lesions or any abnormalities. I'm going to palpate. Let me know if you feel any pain with that.
No.
Okay, and I'm going to check the patency of your nostrils. So if you could close one nostril at a time and breathe in and out. Alright, so that's all normal. Next, I'm going to inspect your ears. So let me know if you feel any pain or tenderness with that.
No.
And I don't see, inspecting them, I don't see any lesions or any abnormalities. Looking at the the outer canal, external canal, and I don't see extrasuberine in there either, so that's all good. With that, I'm going to perform the whisper test. I'm going to whisper something and then just
Sure.
repeat that back to me, okay?
Sure.
So,
Black shoes. Pink chair.
okay. So that's all intact. So that's creatinine number 8. Next, I'm going to move on to your mouth and throat. So I do see his lips are pink and moist. I would be wearing gloves right now, but I don't have any, so I'm just gonna use this and okay. And if you could open your mouth, and I'm looking at the buccal mucosa. It is pink and glistening. I'm looking at the top of the tongue. It is pink and rough, rugueux. I'm looking at the tonsils in the bag. They're about 2+, so that's normal. I'm looking at the hard palate. It's smooth, and the soft palate. I'm looking under the tongue. If you lift up your tongue, it is pink and glistening. There's no abnormalities or any lesions. I'm looking at the gums. They're pink. The gums up here, they're pink. It's all good. I don't see any I don't see any cavities or any problems with the teeth as well. There's no missing teeth or anything like that. Last thing, if you could say ah. So his uvula and his soft palate rose, so that means his cranial number 9 and 10 are intact. And then if you could stick your tongue out, so his tongue is in the midlines, that means his cranial number 12 is intact as well. Okay, that's all good. So I did the head. Okay, next I'm going to move on to your neck. So I'm gonna palpate your, I'm gonna check for enlargement of the glands. So I'm just going to palpate, turn over here. So I'm checking your parotid glands, and then your salivary glands, then your thyroid glands right on the base of the neck. So that's all normal. Next, I'm going to use the pads of my fingers and check your lymph nodes. So I'm palpating in circular motions. So these are preauricular, postauricular, submental, submandibular, superficial cervical, deep cervical chain, and then your posterior superficial, posterior cervical, occipital, and then your supraclavicular. So if you go like this, so your supraclavicular lymph nodes are right here. So that's all intact. I'm gonna check the range of motion of your neck. So if you could turn your head side to side, up and down, ear to shoulder, ear to shoulder. Okay, so his range of motion in the neck is intact as well. Next, I want to check your carotid pulse. So I'm just going to lightly, I'm going to palpate. I would say it's about 2+, and the rate and rhythm are regular. So I'm gonna do the other side. Regular rate and rhythm, and I would say it's about 2+ as well. Next, I'm going to check for any distension. Oh wait, let me auscultate first. So I'm gonna use the bell of my stethoscope and listen to the carotid pulse. If you could take a deep breath in and out and then hold, okay? Okay, deep in and out. Hold. Deep in and out and hold. I do not hear any bruit and any murmur, so that's all normal as well. Next, I'm going to check his distension for jugular vein. So I want you to put your head here, so lay like slightly up, because we want the head of the bed 30 to 45 degrees, and then turn your head to the left. Okay, so I'm checking for any distension is in his jugular vein. So I don't see any bulging, and that is normal. It should be flat, and his is flat, so that's normal. Next, I am going to, can you sit back there? I also forgot to check his sclera and his conjunctiva. So I'm just look up for me. So his sclera is china white, and it's glistening. And then I'm checking his conjunctiva, that is pink, and it is moist. Along with that, I think that's all for that. Okay. Next, I'm going to move on to his upper extremities. So, can you take your shirt off?
Sure.
Okay. So first, I'm gonna look at the upper extremities. So I'm looking all over his arms. I'm looking for any lesions, any scarring, any bruising, and I don't see it. any. I'm checking his temperature. It is warm. His skin is intact. And then I'm gonna check his fingers. And I'm looking at the profile sign in his fingers, and it is less than 160 degrees. Check on this side. So there's no sign of clubbing. I'm gonna check your hands again. I'm looking at the nail beds. They're pink and firm. I'm checking the capillary refill. It is brisk and less than 2, so that's all normal. Next, I'm going to check your range of motion. So if you could hold out your hands for 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And then fold your arms, and then go back out, turn, and then down, and your elbows up, and then turn that, and then your wrist, go straight, and your fingers down. Okay, so his, that's all intact, his range of motion. And then I want to check the strength, so turn back this way, and then pull like this, and then pull me, okay, and then push. All right, and then squeeze my fingers really tight. Okay, that's all intact. Okay. Next, I'm going to assess his respiratory and his abdomen. So I'm just looking all over his respiratory. I don't see any, so yeah, okay, just stay. So I don't see any, stop, any problems, so I'm looking for any lesions, any scarring, any bruising all over his chest. And I'm gonna look at the back as well. I'm looking for any scarring, bruising, or any problems in the back. So in the front, I do see a birth defect. I do see one navi, which is a mole right here. And then I don't see any extra accessory muscle used to breathe. I don't see any pulling of the inner spaces. And then in the back, I do see 2 navis, one scar here, and then a birthmark here, and one navi here. But there's no freckles, so no macules. In the front, there's no macules either. So next, I'm going to listen to his lungs. And then take deep breaths in and out for me, okay? I'm gonna start right here. And then on the right side, let me do this side first, your left. So on the left side, there's 2 lobes. I'm gonna listen to those as well. So just relax your arm, relax. Okay, and then on the right side, there's 3 lobes. I'm gonna do that, relax. Okay, next I'm gonna listen to the back, so if you could turn. Alright, so I didn't, all of his lobes were all clear. I did not hear any abnormal sounds. Next, I am going to move on to your heart, and then I'm gonna listen to your heart. So if you wanna lay down for that. So for the heart, I'm listening for any, oh, and I forgot to mention that when I was listening to his lungs, I listened to his vascular sounds here, and then his bronchovesicular, so vesicular, bronchovesicular, and in the periphery I listen to his bronchovesicular. Oh no, okay. So in the upper here, I listen to his bronchioles, and I listen to his bronchiovesicular, and then vesicular signs in his periphery. And in the back, I listen to, you sit up for a little bit? In the back, I listen to his bronchovesicular, and then vesicular sound in the periphery. Okay, thank you. And then I'm gonna listen to his heart. First, I'm going to auscultate, and then I'm gonna listen with the bell. So I'm listening to the aorta first. Aortic, the pulmonic, and then tricuspid, and then the mitral. Okay, and I'm gonna listen with the bell of my stethoscope. So aortic, pulmonic, tricuspid, mitral. Okay, so I did not hear any S4 sounds. I did not hear any murmurs, and I did not hear any bruits. So that's all normal. I'm also going to auscultate in his fifth intercostal space, listen to his apical pulse, and I'm going to count that one with my stethoscope. Okay, so the rate and rhythm is regular, and I did not hear any bruits. And I would say the rate is about 60. And also when I was listening to his aortic, pulmonic, tricuspid, and mitral, the rate and rhythm was regular. All right, next I am going to move on to his abdomen. So from the side, I'm gonna look at the shape. It is flat, and then at the foot of the bed, I'm looking at the symmetry, and it looks symmetrical. I'm looking at the umbilicus for any drainage, and I don't see any drainage, so that's all normal. All over, I'm inspecting the abdomen. I don't see any scarring, bruising, or any abnormalities. I am going to auscultate for the vowel sounds in all 4 quadrants. I'm gonna do that. Do you have any pain or tenderness in your abdomen?
No.
Okay, vowel sounds were present in all 4 quadrants. I'm going to palpate. So first I'm going to do a light palpation. Let me know if you feel any pain with that, okay?
No. 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 No.
Okay, next I'm going to do a deep palpation all over. Let me know if you have pain or tenderness.
No. 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 Nope. Nope.
Okay, so that's all normal as well. Okay, get it back up. Alright, so next I am going to move on. Oh, let me listen to your lungs in the back. No, I already did that. Okay, so next I am going to move on to your lower extremities. So I'm just going to feel the temperature of your legs. They are warm. And then I'm looking all over, inspecting, and I'm looking for any bruising, scarring, or any lesions, masses, or any abnormalities, but I don't see any. I'm going to look at the back of the legs for varicose veins. They are not visible, so he does not have any, or he doesn't have any varicose veins. And then I'm going to, you can lay back down. I'm going to check your pedal pulses. I'm going to take your socks off. I'm also looking at the hair pattern on his hair distribution on both of his legs, and they are even. I'm going to check his pedal pulses. Okay, so rate and rhythm is regular. Yeah. And then I'm going to check capillary refill in your toes. Okay, so that I would say it's brisk and it's less than 2 seconds. Alright, next I'm also actually going to perform the Babinski test, while I'm at it. So you're gonna feel some tickle, okay? So the normal would be pulling away of the toes, or curling of the toes, or the negative. So he pulls it away, which is also normal, because he's very ticklish. Okay, can you sit back down for 1 second? I'm going to check for edema in the pretibial, or check for pretibial edema. So I'm just palpating around the bony premises. And I would also do that in the upper extremities. I would palpate all over where the bony premises are for any edema. And he does not have any edema. Okay, you're all good. Next I am going to see. Okay. Can you stand up?
Sure.
I'm gonna do the Romberg test on you. So just close your eyes for a couple of seconds. I'm just gonna go around you. No, stay like this, yeah. Like this, yeah. So just close your eyes and I'm just gonna see if you can stay standing. Okay, so that's good. I also have to perform the range of motion on your lower extremity. So can you lay back down?
Sure.
And then move your leg outward. And then the other one outward. Okay, and then bend. Okay, and then that one. And then how high can you take it? Okay. Good. And then can you hold it one leg at a time, 5 seconds each? 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. That's all good. So his strength is equal in lower extremities. Okay. Next, can you sit back up? Yeah, deep tendon reflex. Okay, I'm gonna do the deep tendon reflex on him. So, I'm gonna do his biceps first. So make a bicep. Okay, I'm feeling for his tendon, which is right here, and so I'm gonna hit it, and the normal would be I would see a reflex in his fingers. Okay. Okay, so that's normal. The other side, make a bicep real quick. Okay, right here. Okay, and I'm gonna do it in his quadriceps, so that's below his kneecap. This currently. Seriously, stop. Okay. Okay, so that's normal. I'm also gonna check symmetry of the of the shoulders. Yeah. Okay. So I also have to do the So can you sit up a little? Can you push against my hands? Okay, and then again with my push against my hand. Okay, so that's checking for cranium number 11, so that's intact as well. Next, I'm going to do a light touch test. So I'm going to put this cotton on you and tell me when you feel the wisp of the cotton, okay? Just say now. Close your eyes.
No, 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 no.
Okay, so that's all good. Next, I'm going to do a sharp and dull object. So tell me this is sharp and this is dull. So tell me if you feel sharp or dull, okay?
Mm-hmm.
So close your eyes.
Sharp, sharp, soft, soft, sharp, sharp, soft, soft, sharp, soft, sharp, soft, soft, sharp.
Okay, that's all intact. Alright, so perform all those. Next I am going to, can you stand up and walk for me? Just walk normal. Okay, and then do heel to toe, heel to toe. Alright, that's all good. And then if you hold on to something, the couch. Wait, can they see you? Okay. Then you can hold on to me. Do heel to shin, heel down the shin, and then heel down the shin. Okay, so that's all intact. That's all good. Last, I'm going to check your spine. So turn around, touch your toes. Okay, so I could see his spine is straight. Okay, you can stand back up. I'm going to palpate. So, do you feel any pain with that?
No.
Okay, I do see from the side his his thoracic is in convex shape and his lumbar is in convex shape. And then I do see his shoulders are symmetrical, his scapula and his gluteal folds are also symmetrical. Lastly, if you could turn, just twist your upper body without moving your hips. Okay, so that's all intact, you're good. And I think, you sit back down. Let me just remove. Okay, and I believe that is all.
Well,
Thank
thank you very much.
All right.